on behalf of government and on behalf of Ministry of Health, we want to thank the Kingdom of Buganda for associating with the Ministry of Health's need and always identifying the critical needs at the right time, and you always come in to support us. We want to thank you so much for not only mobilizing the community in Buganda for blood donation, but we also want to thank you so much for historically identifying the real issues, because we've been working with you. I remember even in the time of COVID, you mobilized so much the people in this region to, first of all, get vaccinated. I remember the support that you gave us here in Kampala, the numbers that were overwhelming in Bulange there. I will never forget those lines. We thank you so much for that support, because sometimes we have limitations. Not even sometimes, many times we have limitations and we can't reach everyone. But we want to thank you so much for that milestone, that big push that you gave us. We want to thank you for the sickle cell support. Sickle cell remains a big burden in our country, not just in care, but even in diagnosis. So we will really want to thank the Kabaka of Uganda that support he was giving us on his run, and the returns from his run that were able to raise money to supplement government's effort to improve on the care of the sickle cell patients in the country. We also want to thank you for the work that you have been doing in HIV to mobilize people, not only just HIV care, but also awareness, to continue drumming the sound and the message of prevention, because we do believe that prevention is better than cure. And so we thank you so much for that. Now we want to thank you in a special way for blood drive. You have heard the report that they've given us here in those masazas where they have been moving, the blood that they have been able to mobilize. That's how we have been able to save many lives. You have heard that of late we have started experiencing huge numbers of accidents, unprecedented numbers of accidents. And all these accidents, the first commodity is blood, always. And as you heard that when we get more burdens, we get more demand. Malaria right now, we are in the midst of an epidemic of malaria, the whole country, because of the climate change, because of flooding in some areas. We have seen also unprecedented upsurge of malaria that we had not witnessed before. We've started seeing black water fever that had completely disappeared from our facilities. People are coming with complications of black water fever, and such people, the immediate intervention is blood. Because black water fever, it means that there is massive destruction of blood in the body by malaria parasites, and then you start passing urine that is dark, like it's black. And that requires urgent blood transfusion if you want to save the life of such a patient, and mainly the children. So we really want to thank you so much for mobilizing the population and bringing us together here to get the commodity that you cannot buy, even if you have millions of dollars, to get the commodity that is so precious, that is just synonymous with life. So we thank you so much. Twagala okusiima nese kusiima yenna. Simanyi bwe nsiima naye omanyi jasoyo ogamba nti mwebale setani ya webale sebo nenjikuleeterawo tejja kusoboka naye njagala kwebaza era twagala otuuse obubaka bwaffe ewa Ssaabasajja Kabaka. Twagala okusiima ennyo akulira Kabaka Foundation abadde akola naffe obudde bwonna buno bwonna. Ssebo tukwebaza, ssebo tusiima nnyo omulimu guno gw'okoze mu ggwanga lyaffe. Mukama akikubalire ssebo obuteeganya ate n'okola omulimu ng'omanyi nti sisasulwa naye oyina drive ekutwala ngeri engineered by thy passion to save lives. Thank you so much. Twagala okusiima Red Cross, Blood Bank, n'abantu baffe mwenna abazze okutuwa omusaayi, aba boda twagala okubeebaza ak'ensusso. Nammwe ne mumanya nti bannange si kuvuga boda naye tulina obuvunaanyizibwa nga bannayuganda okulaba nti naffe tujje tukontributinge ku kuwonya abantu abatuuseeko obulemu oba abaagala omusaayi. Twagala mutuuse okusiima kwaffe. Ne abaddona bonna ababadde naffe abatambudde naffe olugendo luno lwonna kubanga nga bwe muwulidde bakyogera wano nti omusaayi tubeera tugwagala buli kadde. Omusaayi bwe tugutwala kati maximum gumala myezi 3. Ennaku 120 30 days. Mwezi gumu gwokka. Kati ekyo bwe kiggwako obudde bwe bugwa kati ogwo omusaayi guba guli expired. So n'olwekyo eno commodity etagulwa ate eri perishable nnyo. So tuba tuddamu. N'olwekyo temujjanga okwo mubeerewo. Ssebo weegombolola tukwaniriza era ffe twagala kukola naawe. Weetuli ssebo. Our doors are open. Always feel free. For any activity, we are always available. And we are always willing to work with you because this is a noble cause. It is a big noble cause. It's a big responsibility. And therefore, we welcome any support. Ssebo, n'ebigambo ebyo mundeke nkome wano nenjagala kukwebaza ssebo mukama wange. Tweyanzege obadde ombuuzaawo ky'ombuuzizza sijja kiddamu ssebo naye njagala kutegeeza nti we treasure the support that we get from you and your team. We treasure the commitment that you have always been at the forefront of the support. Every time we have a need, you are very fast to identify with us in that need. And so thank you so much. N'olwekyo tojjanga okwo ssebo. Era tugamba tusaba bongerwa. Tokomanga okwo ssebo. Weebale nnyo weebalire ddala.